The White House is raising concerns about chronic illness in children, releasing a new report outlining what the administration believes is driving disease in U.S. kids. The report from the Make America Healthy Again Commission blames many chronic illnesses on ultra-processed foods, chemicals in the environment, sedentary behavior, and an over-reliance on digital devices. It also suggests that childhood vaccines need to be studied further, echoing comments from Health and Human Services Secretary Robert F. Kennedy Jr. The report says over 40% of children in the U.S. have at least one chronic disease, such as obesity, diabetes, behavioral issues, and allergies. This report does not outline policy suggestions to address the health issues. So let's bring in FDA Commissioner Dr. Marty Makary to talk more about this. And Commissioner, nearly all doctors agree that a good diet is essential. But when it comes to chemicals, the people growing our food really kind of push back here. The National Corn Growers Association called the report, quote, fear-based rather than science-based whenever it comes to the discussion of pesticides. I'm curious, sir, how would you respond to them?
Well, good to see you, Alex. We've got a chronic disease epidemic in children that does not exist in other countries. If you look at the statistics, they are pretty bad. And so we've got to look at everything. There can be no sacred cows. You can't say, well, you can't look at this one ingredient or chemical that is introduced in the food supply of children in the United States that does not exist in the food supply of other countries with lower rates of these chronic diseases. We've got to take an objective scientific approach. And that's why I'm so excited about this report. It talks about microplastics and circadian rhythms and light and mood and sleep and devices and addiction to these devices and pesticides and the fact that 70% of the food that kids eat today is ultra processed. We never once talked about this, any of this stuff in medical school, and this report brings it to the forefront of our health conversation and really the agenda that we plan to lay out based on this report. This report is a diagnosis.
Well, and Commissioner, you brought up the myriad of things that this report kind of dives into. One of those things was pesticides, and it insists that the American food system is safe despite criticism from HHS Secretary Kennedy about the dangers of pesticides. And so, I mean, some have raised the question. I mean, did the agricultural lobbying group have any influence on this report?
This was a report put together by scientists and experts in the field, and it is unfiltered. You know, this is exactly what we think needs better study. Now, a lot of the report shows suggestions of what we might need to look at when you have things that are different in the United States than other countries. Those are things we have to look at. So the NIH will be prioritizing funding to look at many of these root causes. You know, as a surgeon for over 20 years at Johns Hopkins, we only talked about operating and chemotherapy and prescribing. But it turns out we've got to look at the root causes, because when it comes to the sophisticated stuff like gene therapy, American medicine has been a huge success. But when it comes to the health of the population, it's been a 50-year failure. And I personally do not believe that kids have these high rates of chronic diseases because they have a willpower problem. I reject that notion. It is something in the environment, and it's something to do with the food and the addictive nature of the ultra-processed foods and the chemicals in them that must be associated in some way. So this will inform future research.
Well, and something that I know a lot of parents are paying attention to. The report questions the childhood vaccine schedule. And the report claims that there's been limited inquiry into links between vaccines and chronic illness, but dozens of studies have looked into the safety, and the FDA monitors for possible adverse effects. So I'm curious, I mean, what more research do you think needs to be done here?
Well, for example, the COVID vaccine boosters in young, healthy children. Do young, healthy kids need a COVID vaccine every year for the rest of their life? Does a young girl born today in the United States need to get 80 COVID shots in her average 80-year lifespan? That is a scientific unknown. That's something where we need new research. And so Dr. Prasad and I at the FDA published an article in this week's New England Journal of Medicine saying that that is a different question than for high risk or older Americans. The question of perpetual, never-ending annual boosters in young, healthy people is an example of where we need a clinical trial, at least to check in and ask whether or not it's working, whether or not it's safe and effective because 85% of healthcare workers said no to the COVID booster last fall.
Well, and anecdotally, we've heard some pediatricians raise alarms based off of some of the claims in this report. I mean, I'm curious, can you promise that the FDA will not restrict access to current pediatric vaccines?
Well, the promise of Secretary Kennedy is that we have no plans to remove any vaccines from the market. We do have a charge, however, when we get an application to review the data submitted with that application and determine whether or not the product is safe and effective. And we're going to do that. We're going to stick to both gold standard science and common sense. People have questions and they deserve answers. But the broader issue in this report is that we have to change the conversation to talk about school lunch programs, not just putting every kid on Ozempic, on communities and devices and taking a look at these addictive screens, not just put 1/4 of U.S. girls on antidepressants, which is a piece of these grueling stats that are embarrassing. And when it comes to cancer, we've got to look at environmental factors and toxins that may be causing cancer, not just the chemo and radiation to treat it. So it's an entirely different approach that frames our national health priorities as proactive, not the reactionary system that we have now that is broken, where we throw good money after bad into this broken system. It burdens the federal expenditure. It drives our national debt. It is the largest expenditure of our country, that is healthcare. And we have to fix this problem. And we cannot keep going down this road of blaming kids for being sick and playing whack-a-mole with people when they come into the hospital. You know, cancer in children is going up. Why? Nobody has figured that out. This report puts everything on the table.
Well, and so we have this report, and now I want to look at the roadmap going forward. Secretary Kennedy has said that the next 80 days will be spent developing a roadmap to transform public health. So far, no one has mentioned a cost of this transformation. Does your committee have a dollar amount it needs to address chronic disease?
Well, I'm glad you asked, Alex, because a lot of the stuff we're doing are common sense solutions that everybody agrees on. You know, Republican, Democrat, Independent moms showed up in high numbers to vote for President Trump over this very issue. For example, we took steps to remove all 9 petroleum-based food dyes out of the U.S. food supply. And it will essentially have no cost because you look at these products sold in Canada and Europe, and they use natural ingredients instead of petroleum-based food dyes, and the food is the same price. You look at where we spend our funding at the NIH. We can study root causes to ask ourselves, why are we seeing stomach and liver and pancreatic cancer going up in young people? Colon cancer is going up in young people. The solution is not more operations and more access to care. Those are important tools, but we have to ask, what is it that kids are ingesting that is directly interfacing with the GI tract in direct contact that may be driving the inflammation that leads to carcinogenesis? And so we had a roundtable on talc, which appears in candy. It's ironically been removed from baby powder after an association between baby powder and ovarian cancer was suggested in several studies. And yet kids are eating it every day. So we've got to use common sense. There's low-cost alternatives to talc. And we had a roundtable at the FDA this week on it. It was very lively. We just posted it on the FDA Twitter handle.
I'll have to check that out. Commissioner Makary, thank you so much for your time.
Thanks, Alex.